Welcome, everyone. This is Regarding Men, and I'm here with Janice V. Mingo and Paul Elam, and I'm Tom Golden. And we're going to do something a little different today. This is number 56, even though we've had 57 out, I think. And 56, we're going to call it that because our original 56 had some technical difficulties. So we're going to replace it with this one today. Today, we're going to talk about the coronavirus and all of the factors that play into thinking that maybe this is a real woman's problem. But since our last talk, if you search on coronavirus, men or women, you find out that the LA Times, the Washington Post, the New York Times, and everybody and their grandmother is saying now, wait a minute, men die more often from the coronavirus than women do. In fact, in Italy, they're saying twice as many men are dying from coronavirus as women. And in the United States, it's almost twice as much. And in other places, it's the same thing. So more men are dying. But if you look a little farther down, what you find is there's still a lot of articles out there about how women have it hardest. And wouldn't you know it, Paul and Janice, domestic violence rears its ugly head. And what we're seeing now is all kinds of articles out there about, oh no, social distancing and being cut off from work is going to make it worse for domestic violence. And of course, the implied is it's worse for women, because you see these articles after I took about 5 minutes. And I found 15 articles from Time Magazine, UNICEF, ABC News, of course, the domestic violence people. All these people are saying the same thing. And most of these articles, or some of the articles, will have a picture on it. One of them had a picture of a woman in the distance like this. And in the foreground was this big man's fist, right? It's like the implication is men are victims. No, that's not the implication. And this is the same thing as the Super Bowl hoax, ladies and gentlemen. It's the same freaking thing. They are taking a crisis and turning it into something to push their narrative. And they're pushing it harder and harder. It really is somewhat disgusting. In fact, I was so disgusted by it, I wrote a comment on one of the articles that I found, and it was promptly deleted, So I'm hoping that everybody out there in the red pill army will also do their share and go to these articles and write comments and say, wait a minute, this is nutty. Where's your data to support this idea? Do you have any data? And of course, they'll have to back up and say, no, we're just guessing. Anyway, what do you guys think of all this?
Well, business as usual in the domestic violence industry. I wanted to offer a little bit of counter theory. Aside from the fact that men are dying at much greater rates than women, particularly in places like Italy and China, and there's things that explain some of this that I think that are at least some sort of valuable speculation about why that's happening. Men tend to smoke much more often than women do. They're risk 80%. Takers by nature. I'm sorry, Tom?
The 80% male smokers.
Yeah. And so if you've already got, damaged lungs going into this, considering it's a respiratory illness, it makes sense to me. I wanted to point out, though, however, that since for every 80 cents a woman makes on the job, I make $1, I am actually losing more financially by being out of work. And I think we need to write an article about that.
I think so too, Paul.
Yeah, exactly.
Or actually 2 or 3 of them, because this is discriminatory against men. And that's about the kind of logic that I'm getting out of this. I don't have any doubt, folks. I have no doubt that incidents of domestic violence go up when people are forced into a small contained area with each other, when they're in a general heightened state of anxiety, both parties. There's going to be more conflict. There's going to be probably an increase in all kinds of dysfunctional behavior. You're going to
Sure.
see increases in drinking. You're going to see increases in drug use. Probably even for some people in criminal behavior.
Sure.
I don't have any doubt about that. But of
Right.
course, unlike feminists, I can look at the scenario and find a rational explanation to go over this. But we're not getting this from
Well,
feminists.
and it's
What
worse
we're
than
getting
that.
from feminists is, well, if you as a man happen to drown in your own bodily fluids, the woman you left behind and are no longer providing for is most affected.
Yes.
That's what's happening here. And I think that's why it was worth a second discussion. This is our
Yes.
second consecutive discussion on this virus, because the virus is getting worse, and so is the ideological insanity around reporting on it.
Yeah. And I agree, Paul, that it's definitely going to make domestic violence worse. My concern is that they're only talking about the female victims.
Of course.
You know, that's the only victims that are
Mhm.
assumed to be there is female victims.
Mhm.
But I also have a solution for all this, if you guys are interested.
Sure.
Well, since women get it much less than men, I think we need to take the women, make them go out to the workplace and to solve the problem, have them clean the sewers and them do the high wire stuff and them do the restaurants and have them work, and the men can stay back in safety because the men are the ones who are the most vulnerable, right?
Mhm.
Does that make sense?
Yeah.
Men and children first.
Mhm.
Men and children first. Yes,
Yeah.
Paul, precisely. Yeah, why
Yeah.
not?
Brilliant initiative, Tom. And I've been looking for that from all the proponents of gender equality and from all those who say that women can be superheroes and women are the
Yes.
saviors of the world and women are always the ones who step up. Well, I'm waiting now for feminists and anyone really to come forward and say, okay, this is the opportunity for us to see that heroism in action. Let's see calls to protect men. Let's
Yes.
see calls for women to be on the front lines in every way, since it does certainly seem that women have a natural immunity. And I've been tweeting about this and everything, and then a number of people have said, yes, it has to do with estrogen. You know, it has to do even with chromosomes. There are various biological reasons why women have greater immunity to these kinds of viral infections. So it isn't just the smoking issue, although that may well play a big role too, but the discrepancy between male and female smoking doesn't account for the discrepancy in death rates or even in infection rates. It turns out that men are much more likely to become infected as well. I think it's somewhere between 55 and 60% more of those infected are men. They're saying now 70% plus in Italy. So in one study, up to 80% of the deaths are male. So this is a very concerning thing, and I would expect to see at least a little bit of concern on the part of the women are wonderful, women can do anything feminists, and I haven't seen that at all. There certainly has been a plethora of articles talking about how, you know, skating over the fact that men are dying at a rate of 2 to 1, and mentioning that perhaps very briefly, and then moving very quickly to the economic, the potential economic impact on women, or the potential burden of women having to take on child care roles and caring for elder people. It's really been quite disturbing to see.
Yes.
And so what can you say? You know,
where's the compassion?
Yes, where is the compassion? You know, I read through all of these articles talking about the differential gendered impact and how the crisis was going to affect women more. And every time they would mention the fact of men's greater infection rate and men's greater likelihood of dying, I waited for at least a paragraph where some of these feminist writers would pause over that reality, would lament it, would perhaps quote someone saying what a concerning thing this was, and might make some suggestions about the urgent need for research into why this is and how this can be addressed. And I tried very hard to imagine a pandemic in which women were dying at twice the numbers, in which that wouldn't be front page news every day. I tried to imagine a single article being written by a man saying that, yeah, women are dying much more often, but this is really going to hurt men more. I tried to imagine a single article like that in a mainstream news source, and I could not imagine it. So it is really quite remarkable. There's one article that I would encourage everyone to read. If you want to read just one example, probably not that many of our viewers maybe even want the example, but there's one. I mean, here are some of the titles, for example. Helen Lewis, "The Coronavirus is a Disaster for Feminism." She declares melodramatically that across the world, women's independence will be a silent victim of the pandemic. That's in The Atlantic, one of my favorite magazines. Then we have Courtney Conley's "How Women Could Be Uniquely Impacted by the Coronavirus." Then we have Lucia Graves's in The Guardian newspaper, another one of my favorites, entitled "Women's Domestic Burden Just Got Heavier with the Coronavirus," targeting all the unpaid labor of mainly, it seemed, upper middle class women who are now going to have to rearrange their schedules to accommodate the fact that their children were at home and their holiday plans had been disrupted. There's so many things to say about these articles. One is quite struck by the degree of resentment expressed by so many of these writers about the burden of having to look after their children during a pandemic. It's amazing, the anger about that, the bitterness over it. One of the articles, the one by Helen Lewis, has a paragraph that near the beginning that begins, "Purely as a physical illness, the coronavirus appears to affect women less severely." Yeah, that's true. But in the past few days, the conversation about the pandemic has broadened. We're not just living through a public health crisis, but an economic one. And I thought, you really have to admire the bloody mindedness of somebody that can provide a reference to the fact that women are less affected physically and provide a link to the fact that it's men who are dying in largest numbers from this virus. And then just to move past that. Oh yeah, that's just the physical. That's just people being dead or having a much more difficult time recovering. But let's talk about the likelihood that some women's long-term earning power might potentially be altered. Let's have a whole article talking about that instead. That's really something.
Aside from the obvious burden of so many women doing things like picking up feather dusters and pushing the on button on a dishwasher, I know those things, they're very, very difficult to cope with. But also, I mean, the thread of what I heard you just say there, Janice, has been a common one since second wave feminism, as far back as I can remember, of ideologues complaining about motherhood. As though it's not even a biological choice. As far as I know, women can opt out of being mothers anytime they want to.
Well, an awful lot of them have too, which makes all of this whining even more mystifying.
But it's like, good point. These women are the ones that are having babies are then whining about the responsibilities that come with that. And it's one of the distinctions between the men's movement that I've always loved. Men in the men's movement are activists and they're involved because they haven't been allowed to be fathers. Mm-hmm. Women become feminists because they don't like having to be mothers.
Certainly seems so. Yeah.
The basic message between the two. And I mean, just I still, after 30 some odd years of looking at gender issues, I still just can't wrap my head around the abject selfishness that was just blazing through everything that Janice read.
Yes. And I'll tell you what else I saw or felt in there. It wasn't spoken, but what I felt was, and these men deserve it.
Oh, yes.
It's almost like they deserve
Sure.
to be the victims.
Oh, they
Ooh.
absolutely. That is their
Really?
not well. It's not overt in
Right.
the articles themselves.
You
certainly.
can feel it though.
But you can feel it. And
Yes.
I tweeted your idea, Tom,
Really?
yesterday. Yeah, yesterday I tweeted. No, not to toot my horn like it was so wonderful, but I said, I'm waiting for feminists or anybody to come forward now to say that special measures need to be taken to protect men of all ages from the coronavirus. And we know we would see this if women were dying in greater numbers.
Absolutely.
We know it.
There would be call after call.
There would be
for
call
men to
after
step up
call.
and protect women.
Yeah, protect women. I mean, for instance, there was a joke on Twitter that a friend of mine sent me, a woman saying she had sent her husband to the grocery store to get 2 weeks of supplies for their home. And, ha, ha, ha. He hadn't a clue. He came back with all the wrong types of goods. God. And, he had no idea what was necessary for 2 weeks of family life. Ha, 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 ha. And he said, well, why didn't you go? Why are you sending your husband, especially given the fact that he is much more vulnerable to be infected and to have severe impacts from that virus? Anyway, and so I said that, and then I said, and that given their greater immunity, women need to step up. Haven't seen anything yet. And the flood of nasty comments that I got about that tweet is quite revealing. One person said, medicine has always been focused on men. Meds are only tested on men, and women have always done the heavy lifting in society. Have you been in a coma forever? Another one says, if men, and many jumped on the idea that it's all men's fault anyway. If this is true, many of them doubted it was true. If it's true, it's because men smoke too much and men just don't look after themselves. So some said things like, if men want to stop buying tobacco, I'm not stopping them. Can you imagine if there was a public health crisis where some choice that women had made was making them more vulnerable to something, and everybody just said, well, they chose that, so who gives a damn? Somebody else says,
the way they view rape, I don't see why not.
Yeah, I mean, it's just, somebody says men need to take responsibility for themselves, like they never do. Why is it up to women to do so? Men, stay inside, isolate yourselves, wash your fucking hands. Yeah, right. If men actually stayed inside and isolated themselves and didn't do the work of the world, and our toilets stopped working and the electrical grid went down and all of the transportation systems stopped, we'd be in really big trouble. And men are not going to stop doing all of those things because that's the way men are. So this is just a nonsense comment. Then another person says, you do realize men aren't getting sick more due to biological difference, right? It's because they are more likely to have executive level jobs that require travel and handshakes. Male privilege again. It's because they're shaking lots of hands, and that's why they're getting sick. I mean, the blindness is really, it's just astounding.
And another thing, the narrative about the medical research, and this has been going on forever. Well, they test medications on men. They're geared for a 150-pound male. That's how they calibrate doses, and that's how they do research. And as Warren Farrell pointed out in Myth of Male Power, yes, they do test more on male, prisoners, military, other people. And because there's risk involved in testing medicines. Absolutely. And he said it, I think he put it so succinctly, we test medications more on men for the same reason we test more on rats than human beings.
Mm-hmm.
That's right.
Yeah.
And then feminists turn that into some sort of privilege.
Yeah.
Absolutely stunning. Personally, I think one of the things that women could do to contribute, since we are having shortage of protective gears in hospitals, our healthcare workers, and men are more vulnerable, I think we ought to reserve the protective gear for men and let women go out there in the front lines without protective gear. Tweet that.
Imagine how that's going to fly. Yeah, a lot of people also tweeted back a lot of people said, well, there are all these wonderful nurses, and, so they already have stepped up. And I certainly don't want to take anything away from nurses who are doing a, very difficult job and doing it well. There are wonderful nurses. There are also some really rotten nurses that I've encountered who are incompetent and cruel. But, this is this is their job. There are also many men working in healthcare who are also at risk, men working as orderlies, obviously many men who are physicians, men doing medical research, working overtime now to find preventions and cures for this virus. I mean, it's ridiculous to pretend that this is somehow, that only women's contribution to fighting this virus counts. And at a time when men are being impacted in very different ways, that shouldn't be a public concern. And to give her her due, the coronavirus response coordinator to the White House. Her name is Deborah Birx. I think I wrote it down somewhere. Deborah Birx. Yeah. She did actually mention, she was quoted in, I think it was the LA Times, maybe, saying that it was a very concerning trend that men's death rates were higher. She said, we're seeing this out of Italy, that the mortality in males seemed to be about twice. But then it was really interesting. She said that, and then at least I never saw her actually make that comment, but as she was quoted as saying, this should alert all of us to continue our vigilance to protect Americans who are in nursing homes. And I thought, what? That doesn't quite follow. I think it was just it's so unusual for a public figure to say this should, increase our vigilance to protect American men. Nobody ever says that in public. Right. It did not trip off her tongue. She felt the fallback was, let's protect Americans in nursing homes. And certainly, of course, both men and women in nursing homes should be a particular target of our concern. But, the fact that she couldn't carry on to keep that focus on men also was significant.
I did see that in the press conference with her making that statement, and I watched the dissonance wash over her face as she was struggling for words to articulate this. But she did, to her credit, point out the gender disparity in the death rate. Yeah. Which I suppose is about as good as we're going to get in this culture. And I'm surprised she hasn't been attacked for it.
Yeah, me too, actually. Maybe that's coming. But yeah, good for her for pointing it out. And, and that is, I guess, that's the message that we want to get out today too to men, is be careful. Yeah, wash your hands, keep your distance. At work, if you can't avoid going to work, if you're doing a job that you can't work at home for, keep your distance and wash your hands and stay safe, because men are so important in this crisis. And men are the good news, it's terrible news about death rates going up all across Europe, and the virus spreading in Australia, the virus spreading now in the United States. 35,000, I think, plus are known to be infected. But the one piece of good news is, I think, that 98% so far anyway, reported cases are mild cases. So I hope that will continue.
Is that right?
Yeah. I'm not sure what mild means, really. It still sounds like a pretty nasty bug.
There's various strains, I think, of the virus. I think it's 5 different strains. But some are more.
I didn't know there were that many. Wow.
Yeah. I heard that yesterday. I'm not sure that's right, so don't quote me on that.
And that's anecdotally an interesting thing about this. I mean, with the exception of places like Iran and Italy, where the percentage of infected to death is ridiculously high. I saw in Italy it was like 8.3% mortality rate. In the United States so far, and in many other places, the mortality rate from this is not any really different than it is with typical influenza.
Well, it's a little bit stronger, Paul, I think. It's 1.2 now for the U.S. and the usual is
but
0.1.
it continues to drop as the testing
Yes,
becomes
it does.
available and we identify more cases. It tends to drop, and I'm not at all dismissing the severity of this. And I've read some accounts from people who had it and got over it, and they said that they were floored by the intensity of the symptoms.
Wow.
That they had no way of expecting how hard they would be hit, literally taking 2 steps and nearly falling down from exhaustion, having incredible tightness in the chest. It's a very real thing.
Yes.
But at some point too, I think we also need to get a grip on this psychologically and economically, because the consequences of overreacting to this could be very devastating too.
Yes, exactly.
Yeah, that's a concern for sure.
Yes. I quite agree.
Yeah.
But one thing we know, women are affected most.
And will always be, I'm afraid.
They will always be affected most.
Yeah.
God bless them.
Yeah. So we need to keep saying that men are good.
Yeah, men are good.
Do.
Yeah.
Because the implication of our culture is women are wonderful. Men, oh, well.
Well, and God help us try to manage this crisis without men.
Exactly.
Yep.
And you really will be in deep.
It's unimaginable, it really is.
Yes.
So and the fact that that isn't seen or isn't said is very frightening to me. Really, it is the culture of complaint that feminism has created, and the invisibilizing of men's contribution, of the value of men's lives. I mean, just to go back to the domestic violence business that we started with, again, I agree, that, of course, domestic violence is likely to spike in, the aftermath or during the time of the pandemic. Of course, people are incredibly stressed, incredibly fearful, anxious, everything, money problems, fears about the future, of course. And so does suicidal ideation, I'm sure. So does drug addiction. Everything spikes, everything bad, everything dysfunctional. But it's really interesting. If you do ask feminists, what's your evidence? They'll all point, I noticed there's this one study that everybody cites that shows that after Hurricane Katrina, violence against women spiked by 98%. And you might think, wow, that is a heck of a lot. And why is it that it spiked so much? I mean, I'm not a social scientist, so I'm quite new to analyzing these kinds of studies. But hey, guess what? It's because they did this study of residents of certain areas that were impacted by Hurricane Katrina. It is a real study with a large sample size and everything else. The number of women experiencing domestic violence, at least physical violence, they also counted psychological violence in a different category. That's a kind of crazy category, I think. But anyway, physical violence, the numbers were very, very low, both before and after Hurricane Katrina. So that's why they could spike, there is something like 11 out of, 380. Respondents, and then that went up. I
still want to see the methodology.
Sure, of course, yeah,
Exactly.
I mean, it went up from 11 to 19, or something like that.
We interviewed women at battered women's shelters.
Yeah, sure. Sure. There's lots of other questions one could ask. But the thing about that study that I found so startling, I read the abstract, which mentions this fact. Then I read the actual study. And the abstract mentions that violence against men also increased in the aftermath of Hurricane Katrina, but not nearly as much, only a very small amount.
And they were hurt less.
They were, and nobody, right. But you know what? Guess what? The men reporting domestic violence reported in higher numbers, both before and after Katrina. And that is not even mentioned in the abstract of the report. And men were experiencing self-reporting domestic violence at higher numbers before Katrina than the women reported after Katrina, after this 98% percent spike. So the level of lying and denial is off the charts in
and
all of
narrative
these
pushing.
studies. Yeah.
The narrative pushing is just disgusting. Let me show you a picture of the way it was set up. Isolation could create fertile ground for domestic violence. Well, look at that. You know,
Wow.
that
Wow.
picture shows you this is a guy that's he's gonna hit her. She's poor defenseless lady. Oh no!
Yes.
They're setting things up. They're just setting it up.
Yeah.
It's disgusting.
Yeah, it sure is. Yeah, never let a good crisis go to waste.
That's it.
And you know, I've often talked with friends about, you know, what will it take till our society, you know, can we break this gynocentric narrative? What would it take for us to start to value men again, and to, you know, just get to grow tired of ideological feminism and all of its lies and its hateful, bitter disposition? And sometimes, you know, I've said with friends, you know, it would take a crisis, a huge crisis, where we finally recognize how valuable men are, a war, a pandemic, etc. Unfortunately, here we are at the beginning of a pandemic, or in the middle of it, and it doesn't seem to be happening yet. Let's hope it does.
There's a chance. I think there's a chance, because if you look at this pandemic and you look at the seriousness of all that's going on, and then you look at feminism and the things they're claiming, the juxtaposition is so incredibly difficult to comprehend. It's just, people are hopefully going to start seeing that these things they've been complaining about. What did you say? A culture of complaint? Is that what you said, Janice?
Yeah,
that's a perfect phrase. You know, they'll see that culture of complaint is just crazy. It's just nuts. We got to think about what's happening today.
Yeah,
so that would be one good thing that can come out of this.
Yeah,
I don't know, guys. I still think we live in a world where people will step over the dead bodies of men in order to rescue a woman with a hangnail.
Yeah, with a hangnail. Yeah, I'm talking about how she's having to look after a child.
Yeah,
exactly.
He's home from school or something. Yeah, I don't know. I mean, really, there was an article, a couple articles about how the various closures of parks and restaurants and rest areas and everything is really affecting long haul truckers, who of course are absolutely crucial to keep all the supplies coming to stores that we've all been hoarding and stockpiling over the last few weeks. And they're having a terrible time finding places to eat, finding places where they can sleep, you know, finding facilities to wash up and everything. And they interviewed a number of guys. One poor guy had walked up. There was a drive-through restaurant that was open. He couldn't drive his truck through it. So he walked up to the drive-through window and they turned him away because, you know, not supposed to be there without a vehicle. And, you know, and he wasn't even particularly complaining about it. Imagine if that happened to a woman, it'd be front page news. And I mean, I know there are some women truckers, so all respect to them too, but this is like a 95% male occupation. And you know, and I noticed that all the men that they interviewed, they kept saying things like, look, I signed up for this. I'm not complaining, you know, but, you know, this is the reality, but in this kind of cheerful, matter-of-fact way. And that's simply not the attitude that you find when women are interviewed over even, you know, really rather trivial inconveniences. During this time of crisis, the attitude is always, this is the most terrible thing and everybody should know about it and government should do something about it right away, and, you know, poor me. And I think that's really too bad that that's something that feminist ideology has exacerbated in women. I think actually maybe women, you know, have a natural tendency to be complainers, and maybe that even has a kind of function. You know, women complain, men do things, and therefore stuff gets done.
Absolutely,
maybe there's an evolutionary function.
There is,
but you know, unfortunately, feminism exacerbates it, makes it so much worse, and it's well, you know, it just makes it so much worse.
You know,
I'd like to add something too, as a former over-the-road truck driver. That these guys are dealing with. They have suspended the hours of service rules for right now, which, to let you know, that roughly translates, even with hours of service in place, truckers work their asses off.
Oh yeah.
I have no idea.
Isn't it 14 hours, Paul?
There's 11-hour rules. They've changed some since I was driving, but basically, you work 14, 15 hours a day as it is, and suspending those rules. And then truck drivers were accounted. I'm going to give a shout out to Jack Barnes, a good friend of mine who's still out there And I want to thank him for doing what he's doing he delivers food all over the country to people who need it. We need guys like Jack out there, but he can confirm you'll encounter places where there'll be one restroom for office personnel with a sign up that says no drivers.
Wow.
It's almost like whites only.
Yeah.
That's what truck drivers encounter out there on a good day. The disrespect for these people that are the lifeblood of our societies is absolutely stunning. And
Yes.
they're out there right now cranking it out, trying to keep these grocery stores filled with food. And I guarantee you, they still encounter huge amounts of disrespect out there that would not be happening if they were women.
Yep. Thank you, Jack.
Yep. Thanks, Jack. And to all
Thank you,
you men
Jack.
working so hard to keep things going.
And you know, there are some good things that are coming out of this. And I got to mention one. In the neighborhood I live, you know, the schools are shut down, so all these kids are around. And I watch them. And when I take walks, I watch what's going on. And the kids are playing with each other. No soccer practice, no planned this or that. And so all the kids are having spontaneous play, unsupervised spontaneous play. And I can hear them, man. I walk by and I hear from the garage, they're going, no, we're not doing that. Oh, yes, we are. Oh, no, we're not. Oh, yes, we are. And they go on. This is exactly what they need. They need to be able to do that because that's practice to be able to learn how to problem solve. And this is exactly what we have taken out of our culture. You know, we've helicoptered in so much that kids don't get that. They don't get that unsupervised play where they argue and scream and yell and call each other names and whatever in order to get a problem solved. So we're getting more of that, and that's a good thing. The other thing in my neighborhood, there's these nice pathways to take walks. My wife and I walk twice a day, but now we're seeing, usually we're the only ones walking these paths, right? But now we're seeing families out there with 2 or 3 kids and the mother and the father all walking together. So that's kind of a nice thing too, eh?
Oh yeah, there's some positives. And then of course you turn on the news and you see beaches in Florida crowded with Gen Y and Gen Z people who are just haplessly partying and saying, if I get it, I don't, and spreading the disease.
Yeah.
So, and what I've noticed about that at least is that in those situations, and I know, look, don't get me wrong, I know that not all Gen Y and Gen Z people are irresponsible, selfish asshats, but some of them are, and it looks like the gender distribution is pretty much equal from what I've seen on the news. Dumb guys, dumb girls.
Yeah.
Stay safe, everybody.
Stay safe.
Yeah.
Wash those hands.
One other thing, men
are
good.
Bye-bye.
Y'all take care.
Take care.
We'll see you then.